Mind Australia Recovery College grant exemplifies the disability part of health and disability area of funding. And it does so because the project tackles with a new methodology long-standing issues such as mental health. This is done by empowering people that seek pathways out of their mental health issues to take charge of their lives and their education through the Recovery College, community college model, which is quite popular in the US and UK. We've seen more and more projects requiring funding that aim to foster collaborations between organizations. And this is a trend that we always like to see because we like to grow the sector and we like to grow projects that are more long-term rather than piecemeal one-year projects. But one interesting future trend that we're waiting to see how it develops is the impact that the National Disability Insurance Scheme will have on the sector itself. Philanthropy will be partnering with organizations that aim to change their programs because of the new person-centric approach the scheme will have to the sector. So we wait to see what these changes will bring, and we wait to see how we can best help in this new course of funding. Well, a project that, of course, needs to be mentioned is the National Indigenous Eye Programme, a very large grant the Foundation has made to Melbourne University. Trachoma is one of the major causes for blindness in Indigenous Australia. And it's a very preventable disease, and Melbourne University with the Indigenous Eye Programme are making great inroads towards this prevention. Since the implementation of the project, the percentage of Indigenous kids with trachoma went from 16% to 4%. Well, conditional grants to the applicant sourcing other funding help organizations to be challenged in fundings, but also provides them with a base, with a commitment from the foundation to go to other possible funders, be it other foundations or government. And these grants are made quite often at the foundations and provide pathways, especially when the programs requires a large amount of funding which we can't cover alone.